Right, good afternoon. Thank y'all for joining me from home on 1341. That's our new informational channel here with our new network provider. I know this was supposed to be an in-crowd session, but all that has changed. So we're viewing over TV, and I hope that y'all can hear me okay. I have a couple of people here with me. I'm going to make sure they introduce. First, over here to my left is Debbie McCusker. She's our infection control nurse here at Springmore. Carrie Corley, our healthcare administrator, and Kyle Dilday, our vice president with our management company at RLA. So they're here and may interject some or maybe add to a little bit of what I'm going to say and what I'm going to talk about. So sometimes y'all have heard me jokingly say that I feel like I'm a mayor of a small town, and that's never felt more the case now before than it has now with everything going on of trying to lead everybody in what to do and putting things in order and trying to decide what's best for everybody. So I feel confident in that. I feel confident in my staff, but it's an unknown thing, and we're getting through it together the best we can. So we will move forward, and just wanted to start off with an update and an intro of kind of what we've done. 11 days ago, I sent out my first memo regarding the coronavirus, and it was basically some basic information about what it was, some frequently asked questions, what to do if you have symptoms. And then as the days progressed, it got into things that we were canceling and things that we were stopping due to safety risks that we were hearing about. And then it's got, as late as last night, some more strict policies we've had to put in place, and even stricter today, and that's why we're here. I do want to mention that we get our sources of information from several expert health agencies, one being Leading Age National, Leading Age North Carolina. It's a joint effort with them. There's a state organization within all 50 states and a national in D.C. The CDC, Centers for Disease Control, World Health Organization, CMS, Centers for Medicare and Medicaid Services. They provide best practices in long-term care facilities, and then our local health department. So that's where we're getting a lot of this from. So this is where a lot of this has came. So a lot has changed very fast, and I felt it's time for us to probably take the final step of what we feel like we need to do to kind of get to the ultimate step of kind of mandating ultimate policy. So we're going to move forward with that. I have several things written down in categories that I want to cover. I realize there's nobody here today, so I cannot ask for questions. But I've been receiving a lot of questions via email. I'm getting back to those as soon as I can. But if you have any questions after this, please feel free to call Holly at the front desk or send me an email, and I'll get back to those just as soon as I can. So I want to start off first with screening. Let's talk about employees coming in every day. Obviously, we have to have employees to take care of y'all. So in situations like this in snow where we don't have the luxury of staying home and locking ourselves in and watching TV or playing in the snow, we have important jobs of taking care of each of you. So we've had to put important measures in place to make sure our staff is safe. So we have started screening every employee that comes in each day. This consists of 4 questions that is recommended by the CDC, and also a temperature check for each employee coming in. If the answer to any of the questions is yes, or someone's temperature is above 100.4 or higher, we ask them to go home and stay home for 48 hours. If they check in fine, they will continue to work. So that goes for anyone coming into Springmore, any kind of staff, contractors, sitters, anybody entering the building. We have several stations that we'll have set up that will be starting first thing in the morning with different locations. We have a meeting after this to confirm that and to finalize that. So just be mindful that all staff is being screened, and we're watching them for symptoms and sending them home as necessary. And anything that y'all want to add, Debbie, Carrie, Kyle, please feel free. Yeah, vendors coming in, so we still have to have supplies come in. So we are having that. Having those screened, we're having them drop those off at the main entrance or right at the health center, and then they're leaving after that. But all of those vendors are being screened. And the next is housekeeping. Oh, yes.
Yeah, I just want to clarify. So if we send somebody home with a temperature, They will be required to be out until they're fever-free for at least 24 hours.
24 hours, excuse me. So I'm glad we have some health expert here and clear this up, and it does take a team to figure all this out. Housekeeping, that's pretty routine. We're going to continue housekeeping services as normal, but if you don't want the service or if you don't want the staff member to come in, all you need to let them do is just know when they arrive, and they will be happy to come back next week or the week after or whenever you feel comfortable. But just be mindful that they are being screened every morning. That means, again, temperature checks, the questions, and they're showing no symptoms. So I want you to feel confident in them coming in, but that's just a choice you have. Activities. That's been something we've batted around back and forth, and part of the decision that's been so hard is trying to provide y'all a quality of life when y'all are in a communal setting like this, and then cutting you off from the rest of the world, which is tough. So we started off by continuing all activities. Then we decided we couldn't do large groups coming in. Then it had to be no outside performers coming in, and now we're down to just Springmore events, which when I say a Springmore event, that's something led by Leah or Carrie or one of the chaplains, anything within the wellness department, and that has to be at a limited number now. We batted the amount around back and forth. Governor Cooper says 100 people or less is recommended in the state. Trump the other day, President Trump said no more than 10, but the CDC says 50 or less. So that's the number we're going with. Again, I know we went back and forth with that, but I think we have finally decided that that's the best number for us to use. I'm not saying every activity or class is going to have 50 people, but we feel confident following that guideline. So we'll continue to have exercise classes. Carrie's probably going to have more frequent classes and smaller sizes moving forward. Anything that's in the art studio or any discussion group, we'll continue to have those. Again, they may be limited, and if you continue to check the portal and 1341 on the scroll, they'll give you all the updates for that. So that's what we're doing in activities, and that applies also for the health center as well. So we're having to do small group activities in there as well. Anything else to add on that before we move forward? All right. So next is maintenance. Maintenance is a very important part of Springmore. It keeps Springmore going every day. So only essential contractors will be coming into Springmore on a day-to-day basis until further notice, and that's people that do work on the heating and air system, people that work on electricity if needed. So no type of cosmetic stuff, no cleaning carpets. I failed to mention that in housekeeping, but we have an outside company come once a month to clean carpets, just as a preventative maintenance thing. We have halted that and only having staff do that. And again, the contractors are screened every morning before they enter the community. We'll be having some type of symbol on their contractor badge to make sure if you see them that they know they've been screened. I actually walked over to South Village this afternoon to eat lunch outside, and I saw a family member ask a contractor if they've been screened, and he gave all the proper answers and temperature check and all those good things. So we're screening those very heavily, just as we would anything else. But we have to continue Springmore running. It's got to continue as a business. So there are people scheduled to move in here that have already made decisions to move in here and already given up notices to move here. So we will be continuing to move forward with those important moves, and people have to leave, unfortunately, as well. So we have to make sure that people can retrieve their belongings and move out of Springmore. So any type of contractor coming in, not necessarily for maintenance, but for a marketing standpoint or a mover, all of those will be screened on a case-by-case basis. But again, only the things that are very important business-wise to keep Springmore running. Any other things on that? Going to mention maintenance. Marketing. So marketing's been a tough one. That's another one, again, that we talk about keeping the business running. Again, as everything is shutting down, and Springmore is, to a degree, really shut down, but not completely. We can't shut down. We never, 24/7, 365. So, But marketing, we have stopped all tours, so we're not having anybody from the outside come in and actually tour the community. But we are still talking to people on a one-on-one basis in specific areas, like an office, a designated office, where we continue to gain information and inquiries from people. And we're also getting creative and doing things like FaceTime if they want to see selections in our marketing suite, cabinets and countertops and carpet samples. We're able to do those type things to keep business running. You know, this too shall pass, and we're not sure how long it will be, but things will get back to normal eventually. So we're trying to keep things as normal as possible. So to keep marketing efforts up on a distant way, I think is important. So that's what we have in place for marketing. But again, you'll see everybody touring around the community. A couple of ancillary services we've had to suspend is all the salons, any type of massage therapy coming in. Those are contract workers that are not essential. I know it's very important for many of the residents here to get their hair fixed and their nails done, but we've had to cancel that. Those are non-essential contractors that we decided to suspend. A lot of the other communities we've talked to in North Carolina have suspended those services as well, so we thought that would be best for the time being. Transportation, that has gone back and forth a little bit as well. We have, as recent, continued grocery runs, but we're going to be stopping that effective immediately. We feel that's not the best thing for residents at this point to be out in grocery stores. At one time, we thought that was better than other group places and restaurants, but now that's become kind of shunned against. So we're not going to be doing grocery runs anymore, but please remember we do have a concierge service that we have available. So if you need for someone to go to the store for you, if you call Ken Dunston, he can have that arranged. I know many of you still drive and can get out to the grocery store, and you may help some of your fellow residents, and that's great. I know that happens a lot, but there is a way to still get out to get medicine, to get food if you need to. So just be reminded you can call Ken and he can schedule that. All doctor visits, we're encouraging residents, if it's something routine, to not have to cancel your doctor's appointments. There are some doctor's offices that are closing, some are staying open, but we are going to continue to do medical runs until we feel that that's something that we cannot do or the doctor's office closes down. But again, I do encourage you, if it's something routine, to cancel that and reschedule it for a later time. But I do know that there's some things that are pressing and you still have to have to move forward with. Anything on transportation? Add something, Cody? Yeah.
Just one thing that I'm sure we'll get back to before we're done, but even though you have the ability to go and drive and go yourself, we still encourage you not to go out in those settings. It's still not safe to be out in those settings, so if you can, try to not go if at all possible, even if you're able to drive. I think that's very important.
Yes. And to follow up on what Kyle said, I'm going to be sending out an updated memo tonight to everyone with all these changes. This is being recorded, so we can play this again, but I'm going to send out a memo as I've been doing each day, and I'll make sure that gets to the staff so they're on the same page. We met today for a while and going to meet after this, and then to family members as well. The next two I want to move on to are two of the toughest ones I want to save for last, and that's the Stewart Health Center and dining. So we'll start off with the Stewart Health Center. We've had to alter that pretty much to the extreme of no visitors in the health center at all, now including spouses. We did allow spouses for about a week, and we have come to realize that that's just not the best practice. Again, that's recommended not to take place. Most all, if not all, communities I know are not allowing spouses to come. And that was a very tough decision, but it's one we had to make and we feel confident in. It's tough to say your loved one can't see somebody, spouse, after they've been married for 50, 60, 70 years, but it's something I've been tasked to do, and I've got to move forward with that. So again, it'll pass, and we're going to come up with creative ways of how that you can communicate with your loved one. I've talked with Carrie and Gary and his social worker, and also the activity staff are going to come up with ways to maybe communicate, FaceTime, do something to make sure you don't lose contact with your spouse in the health center. But as far as going in, we're not going to be able to do that. We are going to continue sitters in the health center. We consider those critical staff. We have a lot of residents that are on sitters, and and most of the sitters are Springmore employees. So we're going to screen each sitter that comes in just as we would our own employee. We felt that was important to continue, so that will move forward in the health center. Dining is going to be adjusted in the health center. We're going to have more of the independent folks that can eat and order, eat in their rooms, and more of the ones that need to be help being fed. We're going to spread those out in dining rooms to give some room amongst everybody and to spread staff out. Communal dining has been, is not a. It's been shunned upon as well, and I think we noticed today that all bars and restaurants have been closed. And in North Carolina, it's only takeout and deliveries available. So we're having to follow a lot of those same guidelines. But again, the health center is a little different. The fact that some of the residents have to be fed and watched in their own, specific diets. So we'll have to work with that a little bit. I do feel really good about that. We had another community up in Asheville who's doing the same plan we are, and they even called the state to confirm that we could still have communal dining as long as they're spread out in different dining rooms and they're 6 feet apart to be fed. So we're good on that on the regulation side, and then going to be doing delivery and in-room meals for the more independent health center folks. As far as dining in general for the rest of the community, tonight at 5 o'clock we will be doing takeout only. So lunch was the last day, into the foreseeable future that we'll be dining in the dining room. Tonight will be the only night that we're going to do takeout, and they're going to be staggered times that she has up and is going to be taken care of. She's put a plan together extremely fast and very effective, and I feel very confident in it. So tonight will be takeout. It's going to be very limited, not very limited, but more limited than what you're used to having. There's going to be a hot item and a cold item you're going to be able to pick from. You're going to have a soup, dessert, and 2 sides. So tonight and until the weekend, there'll be 2 of the options that are on the current menu. Again, a hot item, a cold item, 2 sides, and dessert and soup. Once the weekend comes, we're going to switch that up a little bit, and we're going to be able to make it some different options that we don't have on our current menu, and you're going to be able to select as well. Jennifer has a way of going to get with everybody tonight to see what people want for lunch tomorrow, and then we'll have a system in place of if you want lunch, if you want supper, if you want both, if you want the hot item, the cold item, and then they'll collect those every day at a certain time. She'll be going over all that, and we'll pick those up, prepare them, and then they'll be delivered at a specific time as well. So all that information will be out tonight in the dining room. Again, that was a decision we had to make based on what the governor and others are saying about communal dining. Most every community, if not all, we realized yesterday has shut down or were shutting down their dining room after our call yesterday for our Leading Age Weekly call, where we get together with other communities and discuss issues. So that is how dining is going to work. I realize that's not the best option, but I do feel that we are still providing a good meal, and I think we're doing the best we can with that, and that's what every other community is doing, and we're doing as much, if not more, than any other community. Some communities are only doing one meal, but we're committed to doing both meals, which I failed to mention. We are unfortunately going to have to suspend breakfast. So we're not going to be able to do breakfast, but if you want, of course, lunch or dinner, that'll be the option for both. So that's the only change we've had to make is stopping breakfast. The last 2 things I want to talk about are symptoms, and then if we have a possible case, and this may be something Debbie wants to pick up on. But from the very, very beginning, I've told everybody, if you feel like you have any of the symptoms of a shortness of breath or coughing, sneezing, runny nose, any cold or flu-like symptoms, please do not hesitate to call the clinic and have tell them you're having the symptoms and you'd like for someone to come over and check you. We don't want you coming to the clinic and infecting everyone in there, but we will send a nurse like an emergency call off hours, holidays or weekends to your room, and we'll have you checked out. So we're encouraging you to do that. And then once we evaluate you, then we'll determine what the next step is. We will call, if we think it's something where it's a case, we'll call our local health department, and they'll kind of tell us what to do from there. And then if there is a possible case, we have been advised to treat that here on site and not send anyone to the hospital unless it's a critical issue. The hospitals are overloaded with issues right now, and they're saving a lot of the beds for more critical. They think it may get a little worse before it's better, but we've been asked to keep people here and treat them here unless it is critical. So that would be our plan. We would isolate them in the health center, just like as we would with any kind of norovirus, the flu, and then in independent living the same way. I've talked early on about the precautions we're taking are identical to the flu. I was reading an article again today, and it goes back to everything of the flu. So we already have precautions in place of whenever we have the flu in the health center. So that's the procedures we'll be following.
Brandon, can I ask you a question to clear up one thing? If someone is in independent living displaying symptoms to which we get to test for, and they are at that point become isolated, and then of course if they had the positive test to be isolated, will they stay in their independent apartment or will they go to Stewart Health Center?
We'll keep them in their independent apartment. We'll be able to, provide food, provide nurses to come over there. The more we can keep it isolated where it is, the better. So instead of having them go all the way out of the independent down the halls into the health center, even if it's around back, it's a less likely scenario that we would spread it if we keep them in their independent living apartment. That's what's been recommended by the health agencies, I believe, from everybody. So. Those are the main things I wanted to cover. I really hope that I answered a lot of questions. I have, like I said, continued to provide updates that I thought were very important. I'm sure people still have questions, and I'll be happy to answer those. Unfortunately, I can't do that here, but again, I'll send out a memo, and I just ask that for the most of the people watching are the independent residents. We have about 475 residents on any given day, independent residents. And it's extremely important for you to tell your family and friends to, just like Kyle said, to please not come on site. That is very, very important. We are relying on you and trusting you to make sure that happens. And I'm also asking that please, if you have a sitter, to make sure that they come to the very front entrance and they're screened just like every other employee. We know there's outside sitters and they come and go, and we unfortunately don't know everyone, but if you do have an outside sitter, I'm asking that you please have them come to the front and be screened before they come to your apartment, just like a contractor would and just like an employee would. It's the only way that we're going to be able to keep everyone as safe as possible.
Brian, I have a couple of points, if it's okay to just to pick up on that a little bit. We have decided, after lots of discussion, to leave the independent living entrances open at this time. We are going to have signage up that will indicate residents may go directly to their apartment as they enter those entrances. However, if you are a contract person or a sitter of some sort, that you must go through the front lobby, as Brandon said, to be screened. So there will be no one going through the entrances into the independent living except the resident going to their apartment. As Brandon also said, we have restricted visitors in the independent living also, with no visitors allowed there. And again, all of this is difficult for us to do because we know this is your home, but it's important for us to do because we know that we have to do our part in helping to provide a safe environment, not only for you, but to protect everyone from the spread as much as possible. So we recognize the difficulty in all that, but the entrances in NIL will stay open. We had discussed even coming to one point of entry, but think at this point it's not necessary. But we do ask you to please tell your family to not just decide they want to slip in and see mom for just a few minutes, but please to adhere to the policies of not visiting for now. Hopefully this will be short term. We believe that if we can can stick it out for hopefully a very short period of time. I don't know if that's 2 weeks, 3 weeks, I have no idea, but a short period of time relative to what it could be that will flatten out the spread and we'll be able to go back to more normal activities. A couple of other things, I was just looking at my notes to be sure, is first of all, as Brandon said, we really work very hard because we know dining is a very social time and it's a social event. And we did not want to close the dining room. We waited to the last possible minute in order to do that. But we do think that that is prudent for us to do now. So that's why we decided to go in and make that decision. We're sorry that it takes away a lot of the social activity and events that you may have for the day. But hopefully we'll be able to get through this soon and be back in the proper environment. And again, as he said about Stewart Health Center and spouses, that was extremely difficult decision to have to make. But we are making, and you will hear more about, some alternate plans that we can do, as he indicated, to allow spouses to still communicate with their spouse in the health center, whether it be by telephone or by, as he said, by FaceTime or some other Skype or some mechanism. So we are working hard to try to give you that contact again. One other thing is, well, a couple of things is there will be more information on dining coming. It's kind of an evolving thing. We're working on it very hard, have been working on it since last week, but there are a lot of pieces to serving 475 independent residents and then our 140 or so people in the health center. So we're working very hard in order to work through those details, trying to make it as good as it can be for you, and at the same time we have to make it practical because it's a lot of deliveries that have to be done. So most likely when you have a delivery done, you will probably have it done at a certain time and it'll be set at your door and maybe a knock on your door and we'll be moving down the hall. We're not going to be waiting for you to open the door and deliver you hand to hand the meal because it just simply won't be time to do that. So we appreciate your cooperation in doing that. And all of that, of course, will lead to more trash. I think we're very aware that trash disposal can be another issue because we'll have a lot more carry-out containers that have to be dealt with. So we are working very hard to make a plan for that also, which sounds pretty simple, but it's not. So please bear with us, and we appreciate your patience in this. As Brandon and I talked today, it's new for all of us. None of us have been through this before, and so we're working through it the best we can and trying to keep services as positive and as up to speed for you as we possibly can. And I think that's what I wanted to share in addition. Thank you.
Thank you. One of the most important things I think in this whole thing is we're relying on all of you. If you have symptoms, to please stay home. Please, if you have symptoms, do not get out and walk the halls. Do not come to CalPR. Do not come to any activities. Stay home and call us, and let's get over there and let you get evaluated. Because if someone does happen to have it, you could spread it to a lot of people. So it's got to be on you. You know, if you have those symptoms, to get screened before you come out of your apartment. We want you isolated and want to come over and evaluate you and then want to advise you on what to do.
Anything else, Debbie? Any words of wisdom? Yeah, I hope we covered everything. I'm very thankful to have a good team here to work with. Yeah, like I said, in every memo I send out, thank you for the continued support and understanding of what we're having to do. It's very unprecedented. We've heard that 1,000 times now, but I've never in my life, and I hope never again in my life, have to go through anything like this. It's just a very formal setting. There's nobody sitting in here. It's really weird. If you know me, I'm kind of like to joke a little bit or just, I carry myself a little different. But to be so serious, it's just a little odd. But it is that serious. And I joke to people, it's like the end of the world's coming. And I mean, there's nothing you can't go anywhere. You can't do anything. And I'm thankful for all the precautions, but it's a strange time, but we'll definitely learn from it and get through it. And again, it's just to make sure everybody's safe. So, I don't. Yeah, I don't think I may have mentioned that earlier, but just in case you didn't perhaps hear me or I didn't say it, that all the restaurants are closed here. Well, I think all through the state. I think is that right? Yeah, and the bars, unfortunately. for some people like to go out late night. They had to stop all of that, but there's still pickup and takeout available. My wife brought me some Chinese for lunch, which was nice, but that was only just come straight to the door, pick it up and leave, and she dropped it off here at the front. I didn't even let her come in. But it's that's still open. So we're following those same type of procedures, and something may come out, but whenever we're done with this, that it's even more strict. So I just think it was important to go to the most extreme measure so we could just kind of hunker in place and then just get through this so it will get better. So once the next announcement will hopefully be better and more loosened things and more tightened, but that's yet to be determined. So. Well, thank you for y'all's time today. I'm here to answer any questions. If I'm a little slower getting back to you than normal, just please know that I've just been consumed with this for the past week, and that's what I should be consumed with. And I think everybody's been very understanding. We've canceled stuff, but I will get back to you as soon as I can with any questions, and we're always here to help. So thank you.